for it's the journey that matters and not the destination. Hello, this is Dr. Anirban. I secured a rank of 1 in this November session of AIIMS INICET exam. I did my MBBS from JIPMER and I embarked on a journey which would now transform my life to the point where I am standing now. From class 10 onwards, I thought of becoming a doctor. It was never a phase that I never thought of becoming anything else except for a doctor. So I began my preparation from class 11 onwards. College was totally a different place, a foreign land and a hostile environment. But with the unending support of my family and friends, I could get ahead on a journey which would finally land me to the place I am. In first year, I had faced the problems of adjusting with the culture, the language, the food and staying away from my family 2000 kilometers away. And so when the first year results came out, I looked back and had a retrospect that it all was worth all the tears, the hardships, the food and the culture. I'm starting to embrace them. And so then began my actual journey into the professional field, that is from second year onwards. Second year was a phase which I considered one of the best times in my life. I had performed very well in my academics and also it was a time when I explored a lot of co-curricular activities and find the niche in my college. I from my second year started reading quite avidly and attending clinical postings was my motto. As time went by, the desire to learn the foreign language of Tamil also became quite strong, and with each clinical postings I learned new words, new sentences and ways of interacting with the patients. And then medicine became quite interesting when I started to learn from the patients. Third year was a phase where after the grand results of second year, there was instilled a false sense of confidence, a sense of overconfidence actually, that pushed me towards focusing more on exploring myself in extracurricular activities rather than focusing on my studies. But I do not regret about that. It was also a phase when I had started my preparation towards the entrance exam, and I am definitely very happy that I had started from that point. My journey with DAMS started from third year. I took the foundation course and it did really give me an impetus to start and embark on a journey in this entrance exam phase, and the notes also helped me a lot during my professional year exams. I came to know about DAMS from my friends and many of us had enrolled into the DAMS foundation course. The course was very equally spaced. I made full notes and that did definitely help me throughout my entrance examination preparation. In final year, it was again totally different phase. There were clinical postings, there were symposiums, there were lectures for which I required 75% of attendance. It was very daunting, but at the same time I knew I could manage and then become a doctor after 1 year. So that kept me going. And in my clinical postings, the interaction with the patients and the interactions with my professors helped me enhance my knowledge. And after that, after 2 months of the final year postings, then came the COVID pandemic. As surprising it was, it became a totally new path for me after that, and I had to gather myself, I had to gather my resources so that I could study in a way that would provide me the best results. So after giving my best in the final year exams and after getting over the panic situations before the final year exams, as any NEETMDS would correlate, I now was a doctor. I got into the posting of medicine, which was my dream branch. It was the stream I like to be, and so I gave my best in being in the clinics and attending the clinical postings and interacting with patients, and it gave me a sense of confidence and purpose that yes, I would go ahead and be a clinician in this stream. After the medicine posting ended, there was the 3 months of period of community medicine posting. So, but then I did not think this phase would come in my life ever. After the medicine posting ended, my 2 months period of community medicine postings began. But then came the realization when I had to interact with patients at the community level, and we had a 1 month period of compulsory rural service. So in that period of time, there came a big bubble burst. I had to interact with patients in the native Tamil dialect and counsel them and face crowds and manage deaths. So it was quite an overwhelming experience for me, and looking back on my 4-year journey, I had to question myself, did I do it all correctly? After NEET, I had started studying in a full-fledged manner for the upcoming exam 6 months thereafter. But after I got a rank of 168 in NEET, I was very happy, and as were my family and friends. I thought of taking my dream branch in a state college, and every doctor I talked with encouraged me to go and take it and embark on a journey which is far more valuable than an entrance exam. But as the NEET counselings were delayed, I thought that there was no point in sitting back at home and pondering over when the counselling would happen. So I started preparing again, and there were 21 days left. So I sat in my home, I locked my room, and I studied for 14 to 16 hours each day. Some days were less and some days were more, but each day I had to believe in myself and I had to carry on, because this was not the end and I had a bigger purpose. In the 3 hours of the INICET exam, the first 30 minutes were a total mess. I had to change my computer 3 times, and it had never been this case in the whole span of years when I have sat for entrance examinations. But I had that mindset that I have to do it this time, and despite one of the toughest papers that I have faced, I knew it would be tough for everybody else also, and I had to keep my calm for these 3 hours. I attended the morning session of the exam, and the paper was quite equally spaced, but again more tough than I had thought. And the pre and paraclinical subjects were also given their importance, as is done in any other INICET exams. But I was very taken aback by the fact that they had given a lot of importance to the short subjects. A whole 20 to 30% of the paper were coming from that, and I was blessed that I had read those short subjects a lot during this 6 months period. For everybody who is watching, and the juniors and the aspirants who are going to see for the next year's NEET and INICET, I have just few messages for you. Just have faith in your preparation. Make a revision strategy. Sit for one day, just make a revision strategy. It might not go 90% according to the revision strategy, but there would be a skeleton which you would have and would follow in your this phase in life. So for the people who are solely preparing for the INICET exams, I would recommend you to go through the previous year questions at least for 10 years, so that at least 50% of the questions would be very common to you, and there are certain which you have to prepare and give due importance. For NEET, it is a quite holistic approach, and you have to complete your revision twice or thrice at least, and do your Q bank at least twice. And so for everybody who is again very stressed about you are not getting your desired ranks in your GTs or subject-wise tests, I would just have one piece of message for you all, that the exam is only about the 3 hours, and your mindset will decide what your rank is, and not just the revision phase. The mindset you have in those 3 hours after seeing the paper, and the silly mistakes you make, and the margin of error which is very less in NEET as compared to INICET, that would make the difference. And again, focus yourself so that you are prepared for the grand show, that is those 3 hours.